Okay, so we're about to talk about three um, surgeries, So these surgeries, I just put them together, so that we can discuss all of them together like that, because most of them we discuss them in our surgery channels, not orthopedics. But of course, I'm discussing it so that at least the orthopedic students can have a basic knowledge of what these other surgeries in other fields are. So let's quickly look at what we have for this. So we have radical mastectomy, we have radical prostatectomy, we have laparoscopic appendectomy. So all of them are surgeries, and it depends on the extent. Of course, anytime you hear radical, just know that is the highest level of surgery that can be done at that site. You understand that kind of thing? So anytime you hear radical, just know that it's high. So for radical mastectomy, you could see, probably you might not understand this image, but let me explain. You can see how the breast was cut out and the lymph nodes are also being cut out. Now I brought this image here because I don't want to bring some other type of image that will now show breast, because YouTube will term it as nudity. So they don't know that we are medical students and we need to learn some of these things. So I always bring user-friendly pictures. So radical mastectomy, so that is a surgical procedure. It's mainly used for breast cancer. So the entire breast is removed. The underlying muscles are also removed. That's pectoralis major, pectoralis minor. The axillary lymph nodes are removed. So historical context, it was once the standard for breast cancer, but now women, do you understand? Women want to actually preserve a lot of things that have to do with them. So most people don't really use this again, because we have a lot of chemotherapies in, we have a lot of radiotherapies in, and the rest of it. So it causes a lot of physical consequences to the woman. She don't like the way she's looking again. Also causes a lot of psychological disturbances. Okay. Then for radical prostatectomy, I'm completely cutting out the prostate. Okay. So for this one, we said that it involves removal of the entire prostate gland, seminal vesicles, and sometimes you can even remove the lymph nodes that are around that place. So you can do it through the open surgery, you can do it through the minimal invasive. So it's mainly done for prostate cancer that has not gone far. So you just remove everything because you don't want the cancer to even spread further. Okay. So you can cause urinary incontinence, can cause erectile dysfunction. Do you understand? That was one of the craziest shit there. The laparoscopic appendectomy. This one, I'm trying to do an appendix surgery, and I'm just trying to open little holes where I'm able to put the scope. So it's through these holes that I'm able to do the surgery. Okay. So it's a minimal invasive removal of the appendix using small incision and a laparoscope. So it's mainly used in treating acute appendicitis. So you have small incision that will heal faster, okay, and shorter hospital stays, okay, and there is lower risk of you having infections in those various wounds. So that's what we have for these three types of surgeries.